Namaste all. So we have been learning Dravya Guna Vijnana, the herbs, the medicinal uses of herbs, their properties, and the way they should be used, or they can be used, or they are being used by regular Ayurveda practitioners, and as have been mentioned in the classical textbooks. Of course, we also have learned the modern uh, studies which have gone into the herbs, studying the herbs, as has have been happening in various universities in India, overseas as well. So let us start and continue with whatever herbs we have to learn in this series. So the next herb which we will be learning today is Sariva. Stanya Shodhana Gana. The Ganas, let us see. The We've kept a uniform pattern of learning a particular herb. So, as we all know, we start with the Gana. Gana is a group of uh, the herbs which have like properties, similar action, or they have been categorized based on their prabhava, based on their virya, based on their action, based on their affinity towards a particular system or a particular organ. So that is basically Gana. So Sariva is mentioned in Stanya Shodhana Gana. We know what is Stanya Shodhana Gana. Purusha Sangrahaniya. So it will help in the Sangrahan is to hold together. So it will give a uniform consistency, solid consistency to the stool. That is Purusha Sangrahaniya. Jwarahara, that is, it will cure jwara or help in curing jwara. Daha prashamana, it will reduce the burning sensation. Madhura skanda, so again a group of herbs which have madhura rasa or madhura vipaka. Hmm? Majorly madhura rasa will come in madhura skanda. Sarivadi, so there is a gana which is named after Sariva and has other herbs which have similar properties. Latin name Hemidesmus indicus. Of course, when we understand Latin names, there are various species. So, Sariva also would have various species depending on their morphology, their location, their part being used, the color of their leaf, color of the flower, color of the stem, or the properties of the various parts, panchanga, or any medicinal part which is used. So you may find Hemidesmus indicus, you may find other variants of Sariva also mentioned in classical textbooks as well as which have been identified later in the similar species. So they would belong to the similar family. Apart from Latin name, there is a family also according to the botanical categorization which has been done of the herbs. So Hemidesmus indicus is the Latin name for Sariva, which is usually used in medicine. Synonyms: Utpala Sariva, Gopavalli, Gopi, Gopakanya, Ananta. Ananta is one synonym which usually a lot of translators have used, and even we use in our so where we have the containers of the medicines or herbs, we usually don't write Sariva, we write Ananta. Ananta is which does not have any uh, limit. Ananta. Chandana. So Chandana, you may get confused with Chandana as sandalwood as well, but you should look at the translation. You can understand the context where that particular uh, synonym is used in a particular verse or shloka. Dhavala Sariva. So Dhavala Sariva, Dhavala is white. Okay, so Dhavala Sariva is also one of the synonyms. Shweta, Shweta again is white. Sugandha is aromatic. Morphology wise, it is a thin twining creeper about 1.5 to 3 meters tall. So even if it is a creeper, it may not grow very long. It would have a limited reach per se because its root will have a particular strength and limit to which it can grow. Upyuktanga, the medicinal part which is used is root. Attributes wise, rasa is madhura tikta, vipaka is madhura, virya is shita, gunas, guru and snigdha. Actions and uses, toshagnata, vata shamana, being madhura and snigdha and guru. So things which are self-explanatory, I would not emphasize more on, and I have tried to make sentences rather than just pointers so that it becomes self-explanatory and easy to understand. So Vata Shamana, how? Because it is Madhura Snigdha and Guru. Pitta Shamana, as it is Madhura Tikta and Shita. Kapha Shamana, as it is slightly Tikta but does not aggravate Kapha in spite of being Madhura, Guru and Stingza. So this is uh, uh, and the property of Sariva. It does not aggravate Kapha dosha. So few things which are in the properties are due to the nature of the herb. Okay, where prabhava also at times comes into play. Local application: fresh root juice is used as eye drops in Netra Bishanda and its lepa is applied in Daha and Shotha. So wherever there is Daha Shotha, the leper can be used when any herb. I did mention about cleaning a particular wound, cleaning the wound and healing wound with a particular decoction. I have told you that sterility is very critical and important. Filtering of the decoction is important. The containers in which it is filtered is important, and more so when it comes to netra bishanda. Netra bishanda is conjunctivitis. Okay, so when you are using it for the eye is one of the most delicate organs, right? So small a variation in its sterility. So slightest of contaminations also can lead to complications of the eye. So when it comes to application of eye, you have to be very careful. Internal consumption, be careful about sterility and contamination. Internal uses, Annavaha and Purishava Srotas, what is action? It is Ruchikara, Deepana and Pachana, as it is Tikta. Hence, useful in Aruchi Agrimandya. Self-explanatory words, no need for additional explanation. It eliminates Admana being Anuloma. Okay, so Admana is bloating of stomach, inside in the stomach. It is used for pacifying Rakta and Pitta in Pitta and Raktatisara. So Pitta Atisara and Raktatisara. Pitta Jatisara and Rakta Jatisara uh, Sariva can be used. Rasa and Raktavaha elevates Daha as it pacifies Rasagata Pitta. So this is specific action of Sariva. It pacifies Rasagata Pitta. Okay, so uh, it applies to this particular herb, may not apply to similar herb or herb with similar properties. Not essentially. It would, but not essentially. Okay, so few things would be thumb rules, few things may not be thumb rules at all. Okay, So you have to be specific and precise while you study the herbs and while you use their properties. Alleviates daha as it pacifies rasagata pitta. It nourishes rasa and stanya as it is madhura snigdha and guru, and purifies pitta dushta stanya. Now we have studied this in the previous lectures, that stanya, breast milk. It can be it can get vitiated with various doshas. So if, when it is vitiated with pitta dosha, then sariva can be used in order to purify the stanya. It pacifies raktagata pitta, being tikta and shita, hence acts as daha shamana. Okay, daha shamana is pacifying, alleviates daha, burning sensation, jwaragna and shaityakara. Okay, so its action of daha shamana, jwaragna is cures or kills. Gna, I told you, gna is kills. Kafagna, vatagna, pittagna, jwaragna kills jwara. So not literally kills, but cures, helps in curing. Shaityakara, shaitya is cold, feeling of cold. Shaityakara. So daha prashamana and shaityakara are almost similar words. So it gives a feeling of cool, cold, not cold as in the patient will not start feeling cold, but the burning sensation, daha, in the body will reduce. That is Shaityakara. So, cooling agent. You can call it cooling agent. Hence, it is used in Vatarakta. Gandamala. Gandamala is something which I mean, we have not discussed before. So, hence, I will explain. Gandamala is lymphadenitis, the swelling of um, lymph nodes. That is Gandamala. Okay. Mala is garland, basically. Mala is garland. So the lymph nodes get swollen in such a way that it appears as if a garland is being, it appears like a garland or a necklace. Garland is necklace. And Jirna Amavata, hence it is used in Vatarakta Gandamala and Jirna Amavata, chronic Amavata. Sarivadigana is used in Adhoga Rakta Pitta. So the herbs which are included in Sarivadigana, as I have told you, that these ganas, Mahakashayas, you will find in Charaka Sutrasthan in Purvardha. So that is the first part of Charak. You will find these ganas, and of course, not all of them you will find in those, because these notes have been prepared after studying various uh, classical textbooks. So you may find few in Sushruta, Vagbhata, Bhavaprakash, etc., Madhav Nidan. Sarivadi Gana. So herbs in the entire group can is used in Adhoga Rakta Pitta. In Jwara, being Pitta Shamana and Amapachana, it is used to eliminate Sarakta Nishthivana. Okay, Sarakta Nishthivana. This is the Sanskrit word for hemoptysis. What is hemoptysis? That is sputum with blood. Okay, or sputum of blood. That is hemoptysis. Daha, Murcha, Chardi. Few translators have used Murcha. I mean, they have used the spelling Murcha as what I have mentioned. Usually, in my notes, you would find Murcha in order to keep it simple and understand it better. So, this I have kept in order to show that few translations you would find Murcha this as a spelling. Chardi is vomiting. Pralapa is irrelevant and loud talk. And Brahma is dizziness present in Jwara. So, Sariva acts very well. Ananta acts very well in Jwara, as it takes care of the symptoms which have been mentioned in the notes. Daha, it is used in Daha associated with ears, eyes, mouth, hands and feet caused by Raktagata Pitta Prakopa. So when there is Pitta Prakopa, you will find various signs and symptoms which are shown up on the body. So specific burning sensation in the ears, eyes, mouth, hands, and feet. Sariva can be used. It eliminates daha by carrying out shodhana and shamana of pitta. Okay, so shodhana of pitta also would happen with sariva, and shamana of pitta also would happen. So based on the quantities which are used, based on the various preparations of sariva which are used, it will have that particular action. Kushtha, Kushtha is produced by aggravation of tridoshas resulting in visheshan of dhatus. So this we have studied while we studied Kushtha. Sariva is useful in presence of Vaivarne. Vaivarne is discoloration. Uh, Rukshata, that is dryness, Sweda and Shodha. So Sariva is useful in presence of Vaivarne, Rukshata, Sweda and Shodha related to Kushtha. So when you see these particular symptoms and signs in Kushtha, Sariva can be used for treating it. Pranavaha Srotas, it is used in Pittaja Kasa, Kshata Kshayaja Kasa. Kshata is trauma, Kshaya is depletion. So the depletion of the dhatus, Kshayaja Kasa, we have seen the types of Kasa when we studied it. So it is Sariva is used in Pittaja Kasa, Kshayaja, Kshataja Kasa. Tamaka Shwasa, we have seen what is Tamaka Shwasa and Pittaja Bheda. So Pittaja conditions basically in Pranavaha Srotas, Sariva can be used. Swara Bheda for pacification of Pitta and maintain strength of that particular affected organ in Pranava Srotas. Sariva can be used. Shukra Artavaha Srotas, what is the action? It increases Oja and Shukra by its Madhura, Snigdha and Shita gunas. Okay, action on Oja and Shukra. It increases Shukra and Oja because of its Madhura, Snigdha and Shita gunas. Okay, that is quite self-explanatory. Hence, it is used in debility of Shukra. Okay, so wherever the loss of strength of Shukra. So what does strength mean? Qualitative and quantitative, both. Uh, in that case, Sariva can be used. Sariva and Sarivadigana is used as Rakta Prasadana and Stambhana in Pradara and Pittaja and Raktaja Yoni Roga. So I'll just explain this quickly because few words are different here. Rakta Prasadana we know it purifies Rakta Dhatu, and Stambhana. Stambhana we know is to hold Stambhana in Pradara. So Pradara basically is any kind of per vaginal discharge is called as Pradara. Any kind of per vaginal discharge is called as Pradara. So it can be Rakta Pradara or Shweta Pradara. Shweta Pradara is white discharge. Rakta Pradara is the bleeding. Okay, so Pradara is uh, a generic word used for per vaginal discharge. And Pittaja and Raktaja Yoni Roga. Yoni Roga are vaginal diseases, okay, in which Pitta and Rakta are vitiated or show Pitta and Pittaja and Raktaja signs and symptoms. Sariva should be used. Dose Fanta 50 to 100 ml. Kalka is 5 to 10 grams. Kalpas, ready kalpas are apart from, so when we say dose of Fanta and Kalka, apart from that, we use churna or the powder form, dry powder form. So that we use based on the condition of the patient. So it can vary from 1 gram to, in fact, up to 3 grams also per day. Kalpa, Sarivadi Vati. Sarivadi Vati is now Sarivadi Gana Vati, tablet form of Sarivadi Gana. Sarivadya Valeha, marmalade, Sarivadya Sava, the fermented uh, liquid of Sariva. In which Sariva is one of the major ingredients, and there are other ingredients also. Amayik Prayogas, Sariva Kwatha is used with honey in Shwasa and Kasa. So these are specific formulations or ways where uh, Sariva or Ananta can be used in specific conditions. Okay, Sariva Kwatha. So single herb Sariva Kwatha can be used with honey in Shwasa and Kasa. A decoction of Sarivadigana, that is Sariva, Ushira, Pushkara Mula, Madhuka, Shweta, and Rakta Chandana. Shweta Chandana and Rakta Chandana. And Yashti Madhu is useful in Daha, Rakta Pitta, Trushna, Jara, and Raktaja Yuniroga. So, Rakta and Pittaja conditions, Sariva and the herbs apart from Sariva have been mentioned. We have studied Ushira, Sariva, Pushkar Mula, Madhuka, Shweta, and Rakta Chandana, and Yashti Madhu. So, the combination of these herbs and or whatever is available with your out of this can be mixed together and can be used in decoction form in pittaja and raktaja conditions as mentioned. Daha, rakta pitta, drushna, jwara, and raktaja yoni roga. These ingredients are rakta prasadana and stambhana. A decoction of sariva and kamalakanda. Kamalakanda is the stem of kamala, that is lotus. So there is how do we call, like a rhizome root that also is referred as kamalakanda, and they are that is pitta pacifying, pitta elevating. So decoction of sariva and kamalakanda is given with sugar after cooling in pittaja jwara. Sariva chemical composition. The root contains a volatile oil containing salicylic acid, salicylic aldehyde, which imparts a typical smell. So, sugandha, we saw in the synonyms, sugandha. So, it has a very soothing and mild smell. So, that aroma is very pleasing, and that itself is very cooling aroma. So that is due to a salicylic aldehyde. It contains B-cystesterol, tetra. Now you don't have to, as I had mentioned in the previous lecture, also you don't have to remember the names of B-cystesterol or tetra cyclin 3 terpine or fatty acid or ketone or saponins which are present. Uh, as you study in future or whenever you need references for any kind of chemical formulation which you need to do in terms of extracting uh, the alkaloids or the actives out of a particular herb, this can help. Modern research 2-hydroxy 4-methoxy benzaldehyde isolated from the root showed significant anti-inflammatory activity against chronic inflammation in albino rats in the dose mentioned. So, chronic inflammation for us important is it showed good action in chronic inflammation. It also revealed significant antifungal activity. So, inflammation and antifungal activity both are were seen while some clinical trials which were done. Now, apart from whatever has been mentioned, like it works in Raktaja conditions, it works in Pittaja conditions. Um, Everybody, I mean, every practicing doctor, every post graduation student or super post graduation, like PhD students, MPhil students, they have their thesis. Okay, they have their studies. So a particular topic is taken and then they study, as you all know. So they take a modern perspective of, or a western approach towards studying a particular disease, or uh, the classical evaluation of uh, whatever action or properties have been mentioned in the classical textbooks. So evaluating, say, action of sariva in, say, raktaja yoni rog. So they study through the Ayurveda perspective, and few of them go ahead and do Western uh, study through the Western perspective, as in understanding what are the actives and what are its action on a particular condition in the body. Okay, so that is modern research which has been conducted in various universities by various students. So with this, we complete Sariva. We move on to the next herb, which is Sarpagandha. Sarpagandha, which literally that particular word means Sarpa is snake and Gandha is smell. Okay, so smells like snake. Now, what is a smell of a snake, etc.? I would not be able to get into those details, but when it was uh, maybe invented or uh, given a name, a particular name by first time by any rishi, that time they might have realized that it has smell or aroma uh, which is near to, similar to the smell of a snake, maybe. I just gave you the literal meaning of the word. Okay, Gana is Aparajitadi Gana. Aparajita is one herb, and Sarpagandha is found in that particular group of herbs. Latin name Rauwolfia serpentina. Again, you will see serpentina as the word, so serpent, which is again snake. Synonyms: Dhavala Vitapa, Chandra, okay, uh, Chandramara, Nakuli. Nakuli again is I think white. Nakul also means white. Surasa, Bhujangakshi. Now here again it relates to snake. Bhujanga is snake. We know Bhujangasana, right? Snake pose, cobra pose. So Bhujangakshi, Akshi is the eye. So some part of the herb must be looking like the eye of the snake. Hence Bhujangakshi. Vishanashini. Visha is poison. Nashini is to kill. So it acts on the snake poisoning. Hence Vishanashini. Morphology: an evergreen herb about 0.33 to 1 meter tall. Upyuktanga root. Attributes: Rasa, Tiktakatu, Vipakakatu, Virya, Ushna, Guna, Ruksha, Prabhava, Nitrajanana. So, Prabhava, you need to keep certain things in mind when you are using the herb. Okay, so Prabhava, which you really cannot explain through its Rasavirya Vipaka, that is Prabhava, right? So Nidrajanana is the Prabhava of Sarpagandha, and as we have studied the other herbs also, you need to keep Prabhava in mind, and maybe when you prepare notes of your own, you can highlight the Prabhava of that particular herb. Initially it becomes study and keeping in mind, etc., but as you start using it on a regular basis, then you don't really have to keep in mind. It becomes like your lifestyle. Actions and uses: Doshagnata, Kafagna by all attributes, Vatagna being Ushna but is Pittakara. Okay, so Sarpagandha is Pittakara and should be very wisely used. Internal uses: Anna and Purishavaha. The action is Pitta Vardhaka. It aggravates Pitta because it is Ushna. Kafagna, due to all attributes, a mixture of Sarpagandha, one part, plus Kutajatwak, two parts, and Erendamula. Erendamula is the root of castor herb, three parts of that. So Sarpagandha, one part, Kutajatwak, two parts, Erendamula, three parts, is given with milk in Amaja, Vibandha, and Shula. So Vibandha is uh, like constipation. You can say constipation. So there is no movement in the intestinal parts. So the intestine movement is slow. That is Vibandha. And because of accumulation, as there is less peristaltic movement, there is accumulation of mala. Hence, Shula also, Udara Shula, pain in the abdomen also will be seen. And in that case, and similarly, presence of ama because of again indigestion and everything is connected. So you can easily relate to Vibandha Shula and presence of ama. So in that case, Sarpagandha one part, Kutastok two parts, and Erendamula three parts is given. It digests ama, it causes anulomana of vata and overcomes shula because of pacification of vata. Okay, so digestion of ama and anulomana, both things happen. Hence, this combination can be used. In rasa and raktavaha srotas, it depresses heart. Depresses heart means it slows down the activity of heart. Okay, slows down, not the literal meaning of depression. It slows down the activity of heart. It reduces the blood pressure. It eliminates giddiness, headache, irritability of mind, and induces sleep. Okay, reduces blood pressure. Hence, it is an ingredient in a lot of combinations mentioned in the classical textbooks also, and with experience also. A lot of doctors use sarpagandha as one of the ingredients in their combinations, which they use for elevating the blood pressure or reducing the blood pressure. Okay, so sarpagandha is one of the uh, key ingredients in that in those combinations which are used. What is action on Jwara? Amapachana and Jwaragna. So as it is Amapachana, it can naturally be used in the first part of Jwara, right? So we have seen there is the Sama part and then there is the Nirama part of the Jwara. So Sama, Pachamana and Nirama. I will not get into Jwara again, but in the initial Navajwara, Navajwara, Jirna Jwara. So in Navajwara, Amapachana is expected, hence Sarpagandha can be used. It is also useful in treating complications such as pralapa, udvega in Jwara. Udvega is basically excitement or mm, how do we say? So it is a psychological symptom which is of okay. Let as I recall some translation, I will tell you excitement or there is a particular word to it, desperation. Okay, so like desperate uh, a desperation of some kind is udvega. Majjavaha srotas, it can be used in Unmada and Apasmara. Unmada is a group of psychological signs and symptoms which are seen. So Unmada is a particular, it's a disease, okay, and in which the mind is majorly affected. So Sarpagandha can be used in Unmada and Apasmara convulsions when the patient is very irritated. To calm his mind, Sarpagandha can be used. Its powder can be given, as we studied in the previous slide. It reduces the blood pressure, it reduces the the action or the functioning of the heart or the activity of the heart. It will reduce, so it will calm down, particularly calm down the mind, so irritability will be reduced. Its powder can be given with ghee to induce sleep. Majjagata doshas, and I have mentioned this several times in the past also. When ghee is mentioned, Ayurveda expects it to be cow ghee, unless it is specifically mentioned as buffalo or goat ghee. Majjagata doshas are digested by Tiktarasa, and action of Sadhaka Pitta is stimulated by Sarpagandha. Shukra and Artava Srotas, it is used in Sakashta Prasava. Sakashta Prasava means we have seen Kashta Prasava in one of the previous herbs. So Sakashta Prasava is similar synonymous word, which is difficulty in um, the labor. Okay, so in that case, Sarpagandha can be used. Kashtartava and Artava Janana. So in Kashtartava, where there is painful uh, menses, Sarpagandha can be used. Artava Janana is to induce um, menses or periods. Sarpagandha is widely used. Sarpavisha, so that is snake poison. The root paste can be given internally and applied to the site of snake bite. So external application and internal application. Now I had mentioned this in the past as well, that uh, it is not that you come across a patient or the patient comes to your clinic and the patient suspects that it is a snake bite, and you start applying you get sarpagandha, fresh sarpagandha, the root of it, you make a paste of it and you apply it and give internally. Okay, now the snake venom or the action of the snake poison, effect of snake poison will be reduced, etc. It is quite challenging and difficult because the type of snake, whether it was a real bite or the snake just touched the tooth, but uh, the snake did not enter into the skin or the bloodstream. So you are not really aware of what actually has happened. Hence, it is always best to refer such patients to higher setups like hospitals, etc., so that they start the anti-snake venom activities immediately, and things can, because poison is something which can deteriorate the patient very fast. Unless you are really skilled, experienced in handling such patients, I personally recommend not to get into those, but just because it is mentioned in the classical textbooks, hence we are learning. But practical applicability also, I am telling you simultaneously, that if you suspect such patients, it is better to refer them to higher establishments. But if you are practicing in remote locations from where the patient will take couple of hours or 3 hours to reach uh, a higher hospital or establishment, in that case you can try with this. Okay, okay, give me some time, I'll prepare something and give, so that the patient may survive till he reaches uh, a higher hospital or a higher establishment. Okay. In OPD level cases, outpatient department, usually you may not come across, at least in city setups, you may not come across such patients, but the action of the herb, you should be aware that Sarpagandha acts on the poisoning. Now, after effects of the poison also you can, so a patient, for example, if had snake bite and had some complication, was hospitalized and comes back and still has some complications, in that case you can use Sarpagandha in order to combat whatever part of the snake venom is present in smaller proportions in the body or has affected some organs, in order to uh, reverse that action wherever uh, reversible damage has happened. Irreversible damages, of course, are difficult to treat. Wherever reversible damages are there, it can help in reversing the effect of the snake venom on those particular organs. Okay, so in that case, you can certainly use Sarpagandha.
Excuse me, Dr. Swapnil, this is Sonia.
Yes,
Namaste.
namaste.
Can you just elaborate, please, on difficult labor? Would that mean that to help with the dilation of the cervix because it's taking too long? Is that the part of the difficult labor you're referring to?
And that is one thing. However, in that case, the people who are involved in that labor should be Ayurveda practitioners or have learned Ayurveda, or that can also be when suppose the height of the patient is less and the size of the head is bigger, comparatively bigger of the fetus. So in that case, this can be given before, and that okay, in suppose say 2 weeks time or 3 weeks time, we are expecting the labor to happen. So in order to dilate the cervix, this can be given. Okay, so whenever it is mentioned that sakashta prasava and the medicines herbs which are mentioned in order to help in that smooth labor are only to dilate the cervix, that is the only action which is expected. Okay, does that answer your query?
Yes, thank you very much.
Okay, so dose of Sarpagandha antihypertensive, 0.5 to 1 gram. Less quantity of Sarpagandha is used as it has very strong properties. Nidra Janana induces sound sleep, 0.5 to 1.5 gram, and Nidra Janana, or the herbs which are usually used in order to induce sound sleep, they are used at bedtime. I'm sure you must have studied uh, the times when the particular medicine should be administered. So Nidra Janana is usually that medicine is given at bedtime. In Unmada, 1 to 3 grams higher dose of Sarpagandha may be required, okay, depending on the extent of the psychological disturbance which is seen. Again, in that case, if Unmada patient is Pittaja Unmada or Pitta Prakriti Unmada, in that case, Sarpagandha should be very wisely used, mindfully used. Less doses, start with less doses, and then you may increase and see how it works. Of course, this is as we are studying Sarpagandha, hence we are studying the dose in Unmada. But when you treat Unmada, there would be other medicines also which will be which can be used. So in that case, the role of Sarpagandha maybe can be reduced based on the signs and symptoms which are seen. If it is Pittaja, then less quantities should be used. Radikalpas Sarpagandhadi Churna. Sarpa Gandhya, Sarpagandha Yoga. Yoga is again a combination of herbs. Sarpagandha Ghanavati. Okay, Ghanavati is, I'm not sure if you have studied Ghanavati, what it is. But quickly to mention, Rasadina, Kwathadinam Punapakat, Ghanatvamsa Rasakriya. Okay, so when Kwatha is continuously heated, and it takes a semi-solid thick form, that is turned into tablets, so that is Ghanavati. Okay, so the decoction continuously boiled to a stage where it becomes thick, uh, or semi-solid, and turned into tablet form is called as Ghanavati. Okay, so Sarpagandha Ghanavati, decoction of Sarpagandha is boiled to make it into Ghanavati. So that is very concentrated form of that herb. Okay, so there are various Ghanavatis. Every decoction can be turned into Ghanavati. So special note is it is used in patients who are strong, should not be used in mentally depressed patients. Okay, so we have seen that it can be used in unmada or psychological disorders, but wherever you see excitement level, or the patient is hyperactivity, shows hyperactivities, then Sarpagandha can be used. But patients who are already depressed, okay, feeling low in morale, low in activity, there Sarpagandha should not be used, as because it reduces the heart rate, it calms down the senses, it calms down the mind, etc. So it induces sound sleep. So the patients of depression can further go into depression. Hence, it should not be used in patients who show low activity. Okay. Amai Prayogas, its bark powder plus Kutaja bark with buttermilk is indicated in Sarakta Pravahika. Sarpagandha, rose water, and sugar candy is advisable in hypertension. So when you use Sarpagandha, singular herb is usually not used, but that combination can be given in rose water, sugar candy, in order to alleviate the increased blood pressure. Sarpagandha is used for early expulsion of placenta after delivery. So this also gives one more addition to Sonia's query, that early expulsion of the placenta after the delivery is done, or when you see the abnormal placement of the placenta in the uterus, Sarpagandha can be used so that the placenta can be uh, expelled completely. Okay, so remains of the placenta also are there. So there are certain Ayurveda practitioners who have, or Ayurveda uh, skilled doctors, Ayurveda doctors who are also practicing Western medicine, have uh, the setups of labor, so pregnancy and related setups. So that is gynecological setups. They have gynecology practice. So they use certain combinations uh, which will take care of the bleeding. It will uh, prevent excessive bleeding. It will majorly take care of the complete evacuation of the placenta and the remains, pregnancy remains in the uterus, again bringing back the uterus to normal. So there are various combination of herbs, medicines, which few gynecologists, Ayurvedic practitioners, not Ayurvedic practitioners, they are Ayurveda graduates, postgraduates in gynecology, however, practicing Western medicines, but they use certain combinations of Ayurvedic herbs which are helpful, and they know that this is not going to do any side effect to the mother, and to the baby also, because the baby has started breastfeeding. Okay, so and they wisely prepare such combinations, and those are used in their practice. Okay. Chemical composition wise, out of the 80 alkaloids present in Sarpagandha, Sarpina is one of the important chief alkaloids. Other contents are reserpine, serpentine, yohimbine. Of course, when we say Sarpina is one of the actives or the major actives, the other ones also have similar actions, and they also can be extracted and used in various formulations. Sarpagandha, apart from this, in modern research, various studies have been conducted and are being conducted in order to see the action of Sarpagandha uh, on blood pressure and hypertension. Okay, so we find such preparations in the market which have used extracts of Sarpagandha into tablets, which can be used as antihypertensive pills. Initial, if the hypertension is marginal, it is not too much. I mean, it's not a chronic hypertension, or there are other psychological signs and symptoms which the patient is showing, then Sarpagandha is being used. So clinical trials keep happening in various universities. So I know such clinical trials which are being conducted in order to check the action of uh, Sarpagandha on hypertension or increased blood pressure. So the next herb which we will be studying is called as Shalmali. It is included in Purisha Virajaniya Gana. Purisha Virajaniya, it imparts normal color to the stool. That's Purisha Virajaniya. We also have seen Mutra Virajaniya Gana. If you remember, Mutra Virajaniya is giving normal color to the urine. So this is included in Purisha Virajaniya Gana. Shonita Sthapana. So in order to stabilize the blood in the body. So stabilize means wherever excess of blood is going out or blood is going out of the body, so in order it will uh, stop the bleeding. That is Shonita Sthapana. So that this is a group of herbs which have this particular action of holding uh, rakta dhatu or blood tissue in the body. Stambhana, rakta stambhana, basically they do. Vedana sthapana, we usually do not call it analgesic, but it will alleviate the pain. Okay, it's not a painkiller group of herbs. It is Vedana sthapana. It will alleviate the pain. So painkiller is going to uh, kill or make you not realize the pain, but the cause of the pain is still there in the body. Okay, so the cause is not eliminated, the cause is still there, just the feeling of that particular uh, pain is subsided. Okay, that is pain killing action. In Vedana Sthapan, it will alleviate the vata dosha which is causing that pain, and of course the other medicines which are being used, it will keep healing the the other causes, other effects of the pain from which it is arising. So Vedana Sthapana basically is not painkiller, it will do Vatanuloman and alleviate Vata also. Okay, Vedana Sthapana. That is the difference between Vedana Sthapana and painkiller. Kashaya Skandha. So Kashaya Skandha is which has the Kashaya astringent action or properties. So group of herbs which have Kashaya rasa. Priyangvadi Gana. So Priyangu is one herb and a group of herbs which have similar action. Priyangvadi Gana. Latin name uh, Salmelia malabarica. That is one type of herb. I mean species of Shalmali. Then you may find the other ones also. Salmelia malabarica is usually used in medicine. The other species also do have medicinal action, etc. If it is known, then it is used. If it is unknown, then trials are conducted, and if it is found useful, then they are included in the medicine. So the other species also, uh, when you study Ayurveda, that time you would find so many herbs which are mentioned, which you really cannot find. Okay, this particular herb, Lakshmana, for example. Lakshmana, you go and search in the jungles, you will not find it. So there are herbs which are extinct, or which are considered to be extinct because we were not able to trace them. Hence, they are considered extinct, and then they because they are not found, hence they cannot be used in medicine. So as the study grows, or as you go more and more in deeper into the study, you would find the other species which are mentioned in the textbooks, but are not usually used in practice because they were not able to find it. And when they find it, they will do clinical trials, and then they can correlate, oh okay, this correlates to what is mentioned in the classical textbooks, now we can start using this. So is that research or is that invention? No, it is just finding that, okay, we were able to find it. Uh, it is mentioned in the textbook, but we were not able to find it. Now we have found it. That's it. So there's no invention there. But new herbs, for us as practitioners, new herbs keep uh, getting added to uh, the medicines based on when we are able to trace them. That's it. Okay. And hence you may find that suppose sariva, Krishna sariva, Shweta sariva, two types are there. So Krishna sariva is usually used in Shweta sariva is usually used in the uh, medicine, but Krishna sariva, if you find in ample quantities, that also can be used, because but it has certain difference in its properties, so that will be used in that context. Okay, so other species are also available. The entire basis of saying this is other species are also available, but depending on its availability, depending on its plantation, and the known uh, properties, gunas, rasavirya, vipak, then it will be included in the herbs pool of herbs which is available. So Salmelia malabarica is usually used in the medicine. Synonyms: mocha, pichila, as the guna says, pichila. So the similar word is used as a synonym for Shalmali. Why? We will see that in the next slide. Rakta pushpa, rakta is red color, pushpa is flower, so red color flower, hence rakta pushpa. Sthirayu. Sthirayu means it will give stable, it has the potential of giving stable health or stable life. Hence, Sthirayu. Sthira is stable, Ayu is life. Kantakadhya. Now, Kantakadhya is Kanta is thorn, thorn. Okay, so thorn, I'm sure you understand what is a thorn. So its stem has a lot of thorns on it, hence Kantakadya. Ramya Pushpa, Ramya is which is pleasing. Ramya is pleasing. Pushpa is flower. So a beautiful, it has a very beautiful flower. If you search on the internet, you can see that flower of Shalmali, for example, if you put it, beautiful now. March, what April has started yesterday. So February and March, these 2 months, usually you see flowering of Shalmali. So Shalmali is quite close to my heart just because I had in during my undergraduate studies. Shalmali was one of my thesis. I mean, second year we have to study a herb and present a thesis. Shalmali was my herb for thesis. So I had gone a lot of places to see Shalmali and study it, its morphology and its study various studies which have been conducted in universities and by other postgraduate students. So it has a very beautiful flower. If you can find it on the internet. Dirghayu. It imparts Dirghayu. Dirgha is long and Ayu is life. So it imparts long life as well as this tree itself has long life. Morphology. A tree about 40 feet tall, quite a tall tree, and it is uh, it is quite stable, as in it doesn't really fall off that easily. Hence, Dirghayu is one of the synonyms. Mocharasa, moth-eaten bark emits gum or resin which turns smoky gray in color, hollow and light in weight on drying. It is called as mocha rasa. Hence, mocha or pichila. These are the synonyms because of mocha rasa in Shalmali. So this is a resin or gum which comes out of the tree, the bark of the tree. So that is a particular moth which will eat up the bark of the tree, and this resin will start coming out. And this is gray in color, light in weight, and it is very useful in medicine. We will see is its uses in the next slides. And Mocharasa is a very important herb, I mean ingredient in our practice, regular practice, Mocharasa. Upyuktanga, root, flower, gum, that is Mocharasa, fruit, and the bark are used in medicine. Attributes wise, Rasa is Madhura, Vipaka is Madhura, Virya is Shita. Madhura Madhura Shita, gunas are Lagu, Snigdha, and Chila. Mocharasa, the gunas are a bit different, hence mentioned separately. Rasa is Kashaya. Okay, so the other parts of Shalmali are Madhura, whereas the resin is Kashaya, Vipaka is Madhura, Virya is Shita, Gunas are Lagu, Snigdha, and Pichila. So rasa of Mocha is different than and that of the other parts of Shalmali. Actions and uses. So because of Kashaya rasa, Mocha rasa has different uses. Okay. Actions and uses. In Doshagnata, let us see root is Vata, Pitta, Shamaka, but Kafakara due to its Madhura rasa and Shita Vipaka. So it is used in majorly Vata and Pitta. In that also Pitta, Shamaka. In Pittaja conditions more than the Vataja. Mocharasa is Kapha and Pittagna. Okay. Local application Shalmali bark being Kashaya and Shotahara is used for application of its lepa to Vrana Shotha. So wherever you see shotha, swelling of or edema on the wound, a leaf of shalmali bark can be used. It acts as vimlapana. Vimlapana, what is vimlapana? It eliminates inflammatory edema, is called as vimlapana. Eliminates inflammatory edema and eliminates daha by its shitavirya. Hence, it is used in Vranashotha. Mocharasa, powder of the mocha, the mocharasa, because it is the gum form or the resin form, it has a particular uh, shape. So we have to make it into a powder. So mocharasa powder or pushpaswarasa, the juice of the fresh flower, is applied locally to stop bleeding from wounds. So mocharasa basically, because it is easily available in powder form, it can be stored in your clinic setup. Hence, just quickly make it into a powder in water also you can make, or sprinkle that powder on the bleeding wound. It will immediately start. I mean, start its action and stop bleeding. Okay, so because as it becomes wet with blood or water, it becomes sticky. Okay, pitchila. Hence, pitchila is one of the synonyms used for it. So, mocharasa, you have to make sure that it is uh, preserved and kept properly, stored properly in your clinic. The containers which are used are clean. It is checked regularly. Usually, resins and gums, they do not spoil unless the containers are not clean or they are not properly stored. Uh, Only then it will get contaminated or it will get spoiled. Otherwise, it will just stay for quite some time, okay, for months and months together. So that powder can be used for bleeding disorders or external bleeding, majorly in wounds. Moisturizer is included in tooth powder. Okay, so bleeding gums, it will act very well in tooth powder. So I had mentioned in one of the previous in the last lecture, in fact, when we were studying herbs, that tooth powder can be a good combination, ready preparation, which can be sold over the counter in your clinic setup, or can be used in various conditions. Uh, so we have seen the herbs which we studied previously, or in your first year or the previous lectures, whatever you have studied, bring the herbs which act very good in the mouth diseases, bring them together and make it into a combination and call it a herbal tooth powder or Ayurvedic tooth powder, etc. So Mocharasa is included in tooth powder and Gandusha by its Kwatha. Uh, so Kwatha can be performed to treat Mukhapaka and bleeding gums. So Gandusha, we know Gandusha, Dharane Gandusha, in Mukhapaka and in bleeding gums. So majorly Pittaja condition, Raktaja conditions, Mocharasa can be used for Gandusha. It heals small ulcers on mucous membrane of the mouth. It heals small ulcers on mucous membrane of the mouth. So Mukhapaka basically, it works very well. Spikes is crushed with milk. Spikes basically the thorn. Okay, kanta is crushed with milk, and the paste so formed is applied cosmetically to eliminate discoloration of the facial skin and acne. Okay, so uh, wherever there is discoloration due to acne on the face or on the back, so the powder form also is available of the thorn, or actual thorns can be collected from the jungle, or also now here in India at least we have pharmacies which keep thorns as as a product in order to give to the doctors, and we as practitioners we give the thorns to the patient, or if powder is available we give powder, mix it with the milk, make it into a fine paste and apply on the discolored part. So it can be face or any part of the body where discoloration has happened due to acne. Okay. And other pittaja, raktaja conditions where discoloration has happened, Shalmali still can be used. It can be used in Kushta also. We'll see in the next slides. But the spikes or the thorns are very good for discoloration of the skin. Okay. Internal uses. Annavah and Purushava Srotas in Atisara, Pravahika and Grahani. Mocharasa being Stambhana due to its Kashaya Rasa and Shitavirya is used in Nirama stage of the three diseases which are mentioned. Nirama stage, why? Because it gives Stambhana action. Okay, whenever there is armor going out, we know that we do not do Stambhana, we do Dipana Pachana, and uh, the Sangrahan automatically happens. However, when there is Nirama stage of Nirama Atisara, Nirama Pravahika or Nirama Grahani, Mocharasa can be used. A coarse powder of Mocharasa is boiled with goats or buffalo milk as per Kshirapaka method and used internally or as Pichabasti in Raktatisara, Rakta Pravahika and Gudapaka. So, in Raktaja conditions of Atisara, Pravahika or Gudapaka. Gudapaka is basically uh, uh, abscess or boils in the anal region. So there Pichabasti can be used. Of Pichabasti, Picha is basically Pichila, sticky Pichila dravyas are used in that Basti. Hence, on the Basti dravya. Hence it is called as Pichabasti. Rasaraktavah Srotas, Arsha. In Arsha, Mocharasa and powdered dry petals of Shalmali flower are useful in bleeding piles. Raktaja Arsha. When used internally with sugar, honey, and rice washing. So it can be given. Pichabasti also can be used, and Mocharasa with the dried flower petals of Shalmali can be given internally with sugar, honey, and rice washings together, or just sugar candy, or with just honey or rice washings. Washings, I'm sure you are aware that first wash is thrown away and the second and third can be used. Rakta Pitta, its flowers and Mocharasa being Stambhana, their powder or decoction is given internally to control bleeding in Rakta Pitta. Flowers, Mocharasa, as we saw in the previous one also. Here, the Stambhana Guna. So it works very well in Raktaja conditions. Mocharasa acts very well in Raktaja conditions of any sort. Okay. So be it bleeding per nose, per vagina, per anus, per urethra, it or bleeding gums, it will act very well in that. Okay. Shukra Artavah Srotas, due to its Kashaya Rasa, Mocharasa is Vranashodhana, cleanses the wound, and Ropana helps in healing and the wound. Uttarbasti is given using its decoction to heal ulcers present in the Garbhashay Mukha, which causes Shweta Pradhana. Okay, so if there are any uh, ulcerations or wounds present on the cervix, Garbhashay Mukha is basically cervix. So Uttarbasti is basti through the urethra. Um, is given, okay, not urethra, the cervix basically. So the Uttarbasti goes into the the uterus in the female. So wherever there is garbhashay inside, if there are any wounds or ulcers, or even the garbhashay mukha, cervix region, there picha or the decoction of mocharasa can be used in order to give picha basti. Its decoction can be used internally as well as for uttarbasti in yonigata shweta srava. So a white discharge, shweta pradara and shweta srava would be same, and also in nirama state of rakta pradara. Decoction can be used internally as well as for uttarbasti in yonigata shweta srava, also in nirama stage of rakta pradara. So bleeding of any sort, ulceration of any sort, wound of any sort, here internal or external, mocharasa, decoction of it will certainly help. So by now you must have started realizing if a particular condition patient comes and what all herbs can be put together, in what form it can be used. Okay, so these connecting the dots, it will slowly and gradually happen. It is not a overnight process. Okay, Pushpa Swarasa and Pushpa Swarasa and a cooked vegetable of Shalmali flowers. And this is a bit different. Shalmali flowers, fresh flowers, if they are available, then those can be cooked as a vegetable and can be consumed. You can tell a patient of Rakta Pradara. So a patient who has menorrhagia, the frequency of the menses is more, or when it in regular cycles also, if the bleeding is more, so fresh flowers of shalmali can be consumed. Okay, so the juice of it can be consumed, it can be made into a vegetable and can be consumed like that as well. Mocharasa siddha ghruta is now wherever shalmali flowers are freshly available. In that case you can do this, else mocharasa can be used. Mocharasa siddha ghruta is useful in all types of pradara. In its Niramavastha, as we know, it does Stambhana action. So, Mocharasa Siddha Kruta is useful in Niramavastha. It treats general weakness also. Okay, so it will give Dhatu Bala. It will improve Dhatu Bala. Hence, it is good in generalized debility. So, if you see here in the first attributes, it is Madhura Madhura Shita. Okay, so Madhura Madhura Shita is good to give nourishment to all the dhatus, right? So when the Agni, Dhatu Agni is good, that time Madhura Madhura Shita can be used. Dose root powder 2 to 3 grams and is given with rice washings. Pushpaswaras 10 to 10 ml juice of the flower, 10 to 20 ml. Fruit powder 2 to 4 gram. Mocharasa 1 to 3 grams internally and 3 to 6 grams for Pichabasti. Radikalpas Shalmali Gruta is available. Of course, we do see proprietary medicines, proprietary as in, and the ganas which are in which you can find these herbs. People do make gritas or vati tablet form, or mocharasa for that matter is used in anti-dysentery medicine or uh, menorrhagia, Rakta Pradar medicine. Those are used. So those are because proprietary medicines, hence the mention is not here on the slides. Only the ones which are mentioned in classical textbooks or in Samhitas, those are included here. Shalmali Gruta. In Amayik Prayogas, you can Shalmali bark can be used with milk in Pradara. Paste of Shalmali root prepared with milk is given internally with sugar candy for nourishment of dhatus. Okay, now wherever fresh uh, root is present, if you can find or trace a Shalmali tree near your setup or in a jungle close to your practice setup, one thing which I always tell uh, juniors or students or who learn uh, Ayurveda, that try to identify fresh herbs wherever possible, plant them, grow them in the close vicinity of your clinic, or at least visit a nearby jungle every week and identify herbs. And wherever permission is required, take permissions. Wherever permissions are not required, take permission of the herb and pluck them, be it any medicinal part of the herb which you are going to use, and use them fresh wherever possible. Wherever it is not, uh, and other forms of the medicine are available, like powder form or tablet form or gritas, oils, or asavaristas. Those still can be used. But fresh herbs, if you are able to locate nearby or the near vicinity, they always help when the other forms are not available. Okay, so you can locate such herbs or you can plant herbs in the vicinity of your clinic. Okay, so paste of Shalmali root. Now, when we say paste of Shalmali root, if it is fresh, it is better. Paste of its root is, or else if dried version or dried form of the root is available, then it can be make into a powder with the milk and can be consumed. Paste of its roots is administered with nutmeg powder. Nutmeg is Jatifala in Prameha. Paste of its root is administered with nutmeg powder in Prameha. Its gum or Mocharasa is given with sugar in Jirna Atisara. Okay, so Jirna Atisara is chronic Atisara patient. Mocharasa is given with sugar. Root powder is administered with buttermilk in Atisara. Root decoction is given with milk in Daha. Daha, so in order to reduce the burning sensation. Chemical composition wise, the root contains starch, sugar, proteins, minerals, fat, tannin, and cellulose. Contains naphthaquinone and B-cystesterol also. Mocha contains minerals tannic and gallic acid and catechol-tannin. So the alkaloids or actives, they have, even if we are not aware of the names, we know the action of various parts of Shalmali, which can be used in medicine. Okay. Modern research, hypoglycemic activity of different parts of Shalmali has shown good results. So has shown good results in Prameha. Okay, so hypoglycemic activity. So the next herb which we are going to learn is Shankha Pushpi. Okay, it is found in the classical textbooks. You can find it in Guduchadi Varga. Guduchi is a herb which you have studied before. So Guduchadi Varga is one of the groups of herbs in which you can find Shankha as one of the ingredients or participants. Latin name convolvulus prostratus. Now, convolvulus prostratus, there are other species also which are available. We are studying the properties of convolvulus prostratus. Synonyms: Kshira Pushpi. Kshira is milk, okay, or milky secretion. Okay, Kshira is in the context of herb, it is milky secretion. Kshira literally means milk. So go Kshira or uh, mm, goat, Kshira of goat or go of buffalo. So Kshira Pushpi, uh, the flower looks like milk or has milky secretions. Mangalya Kusuma. Mangalya is auspicious. Kusuma is flower. So maybe the flower of Shankupushpi being used in on auspicious occasions. Hence Mangalya Kusuma. Supushpi. Medhya. Medhya is which has good action on the medha or the intellect. Smriti Hita. Smriti is memory. Hita is beneficial. So beneficial for the memory. Hence Smriti Hita. Malavinashini. We'll see as we see the next slide. So we'll see what is Malavinashini. Morphologically, a perennial creeper spreading on the ground and branching from the Mula Stambha. Mula Stambha is its root or the rhizome, you can say. Upyuktanga Panchanga, the entire plant or the herb is used in the medicine. Attributes wise, Rasa is Kashaya, Vipaka is Madhura, Virya is Ushna. Kashaya, Madhura, Ushna. A very different combination. Uh, difficult to find such combination. Kashaya, Madhura, Vipaka and Ushna Virya. Gunas, Snigdha and Pichla Guna. Prabhava is Medhya. Now I think you've already studied few herbs which have Medhya Prabhava. Okay, I will not ask questions now. It is your homework and study what is which are the herbs which have Medhya Prabhava. So such herbs can be used together in conditions where you expect Medhya action, especially in children and in psychological disorders as well. Actions and uses: Doshagnata, Kafagna being Kashaya, Pittagna due to Madhura Vipaka, and Vatagna being Ushna. So this is Tridoshagna. Okay, Shankapushpi is Tridoshagna herb. Local application: its medicated oil is used as Keshya. It is Kushtagna because of its Kledagna action, and also Dushta Srava Nashak. It reduces Dushta Srava or sticky secretions which come out of the Kushtha, okay, or the affected part. So the sticky secretions or foul secretions which come out of the wounds or unhealing wounds or Kushtha. In that case, Shankapushpi can be used. The Kashaya Rasa of Shankapushpi acts Kushtagna. Internal uses: Anna and Purishavaha Srotas. It is used in Agnimandya, Anaha, Gulma. Gulma is basically tumor, or it can be a solid tumor like a cyst, or it can be, as per Ayurveda, it can be a Vataj Gulma also, okay, which is a shape, a round shape. However, it is due to accumulation of Vata inside. As Deepana, because it is Deepana action, it works very well on Agrimandyana Gulma and Vatanuloma due to its Ushna Virya, Pichilaguna, and Madhura Vipaka. It eliminates Vibandha by expelling vitiated doshas from the intestine due to its Anulomana action. Okay. It is useful in Arsha. being Anulomana and Raktastambhana. So it will, we know that in Arsha, Vibandha can be or Avashtamba can be there. Hence, Anulomana herbs will help there, and Raktastambhana. So if there are bleeding tendencies, Shankapushpi also can be one of the ingredients, as we saw Mocharasa in the previous herb, Raktastambhana. Here Shankapushpi also can be used. Like Haritaki, it is Ushna and Anulomana. Even if it is Kashaya Rasa, still it, because of its Ushna Virya, it is Anulomana. Okay. And with Kashaya Rasa, it has Rakta Stambhana activity. Okay. So even if it has Kashaya Rasa, it does not cause Avashtamba, that is Stambhana. Okay. On Pranavaha Srotas, it is used in Kasa, Swarabheda, and as it is Swarya due to its Snigdha and Ushna gunas. Hence, it is used in Swarabheda and in Kasa also. So, whenever you see Rukshata or dryness in Kasa, Shankapushpi can be used because it is Snigdha and Ushna. So, it will work well in Vataja type of Kasa, Vataja type of Swarabheda. It will act good, Shankapushpi. Rasa and Raktavaha Srotas is used in Rudroga as it is Balya to Rudaya due to Madhura Vipaka and Pichilaguna. It is useful in Raktapitta and in hematemesis. So hematemesis is vomiting, blood, vomiting with blood. That is hematemesis. Being Raktastambhana due to its Kashaya Rasa. It is also useful in hypertension as it pacifies Raktagata Vata. So this is a specific condition, Raktagata Vata, in which Archankopushpi will be very helpful. Majjavaha Srotas, it is best Medhya substance and has its main action on Majjavaha Srotas. We saw its Prabhava. What is a Prabhava? Medhya. It has Medhya Prabhava. So it acts very good on Majjavaha Srotas. In Unmada and Apasmara, it is as it is Medhya, it eliminates irritability of mind and irritability of the nerves and acts as Mastishkabalya. Mastishkabalya means gives nourishment to the central nervous system or Majjavaha Srotas, especially the brain. Hence, Mastishkabalya and Nidra Janana induces sound sleep. Okay, so it can be used in Unmada. Hyperaction of the psychology. So basically, psychological disorders in which hyperactivity is seen. In that case, Shankapushpi can be used as it induces sound sleep. And again, care can be taken that wherever you see depression or low activity of the mind, Shankapushpi can be avoided. Hence, used in Unmada, Brahma, Apasmara, Anidra. Anidra is sleeplessness caused by mental weakness and irritation. Mental weakness here is Hina Sattva. Okay, so Hina Sattva is getting irritated or getting hyper with less or conditions which are still controllable. But because of Hina Sattva, the patient is not able to manage his or her emotions. So in that case, Shankapushpi can be used. It gradually overcomes acute episodes of Unmada. So it should be used for a longer term, and it will gradually take care of Unmada. So Shankopushpi is a good herb, singular herb also, which can be taken on a long-term basis in psychological disorders. It's not that it will have a slow effect. It is something which can be taken for a longer time. Hence, that sentence in the previous slide, that it will gradually reduce the Unmada. So it's not that it has a slow action, but it can be taken on a longer term. It is used in Anidra, Pralapa, Santapa. So Anidra, Pralapa, Santapa is the heating or the burning sensation. Okay, etc. Associated with Tridosha Jwara. In Jwara, we have seen this word Santapa. Tridosha Jwara and as Majja Shamak. Okay, Majja Shamak. It nourishes Majja and Shukra Dhatus due to its Madhura Vipaka and Snigdha and Pichila Gunas. It nourishes Majja and Shukra Dhatus due to its Madhura Vipaka, Snigdha and Pichila Gunas. Okay. So, similarity, Vriddhi Samanaihi Sarvesham. It pacifies Vata and the mind by nourishing Majjadi Dhatus in cases of Unmada and Apasmara caused by Dhatukshaya Janya Vata Prakopa. So, wherever you see Vata Prakop due to Dhatukshaya, okay, we have seen Rajakshma, etc., and even in Karsha. So it pacifies Vata and the mind by nourishing Majjadi Dhatus in case of Unmada and Apasmara. So in those cases, if you see psychological disorders or convulsions, in that case, Shankapushpi can be the drug of choice. Okay. Shankapushpi is Ushna Kantikara. Kantikara means gives good complexion, improves complexion. Balya, Agnidipana, and Krumigna. Krumigna is vermicidal action. Brahmi is Shita. Swarya. Swarya is good for the voice. Shotahara. It will alleviate Shotha. Shotha is edema. Ayushya. It is good for Ayushya. Ayushya is life. And Raktadushti Nashanam. So Raktadushti, it will cure Raktadushti. Hence, Shankapushpi is used in Vataja type of conditions of psychology, Brahmi, Pittaja type of conditions, Vacha and Nirgundi in Kafaja diseases affecting brain and the mind. Okay, Shankapushpi in Vataja, Brahmi in Pittaja, Vacha and Nirgundi in Kafaja type of psychological disorders. Okay, so uh, where central nervous system, brain, and the mind are involved. In such conditions, you have to identify the signs and symptoms of the patient, and based on that, the uh, planning of Shankapushpi or Brahmi or Vacha, Nirugundi, if it is available, Nirugundi should be used according to the doshaja type or dosha dominance. Okay. Shukrartava Vaha Srotas, it is Vrusha, Prajasthapana being Snigdha, Pichila, and Madhura Vipaki. Okay, Vrusha is, we know it increases libido. Prajasthapana is, it is helpful in the implantation and preserving the pregnancy. That's Prajasthapana, because it is Snigdha, Pichila, and Madhura Vipaki, and of course it has affinity towards the reproductive system, hence also that action, Prajasthapana and Vrusha. Hence it is used in Shukra and Garbhashay Daurabalya as Prajasthapana. Okay, so wherever you see Daurabalya of Shukra, Garbhashay, here Shankapushpi can be used. So uh, repetitive abortions are there, or there is a previous history of abortions. In that case, Shankapushpi can be used. Okay, because then it will also work on Shukravah Dhatu, Shukravah Srutas, Shukra Artavah Srutas, and also on the psychology, on the mind as well. Okay, so or premature ejaculation, for example, in case of male. So in that case, Shankapushpi when used, it will act on the mind as well as on the Shukra Dhatu. Okay, so it will have a dual action in both the cases, abortion or premature ejaculation. The mind of the person is quite disturbed. Okay, even if they don't show, the effect is very intense and strong. Okay, so whenever you are dealing with patients with uh, infertility, or who are coming to you for pregnancy, okay, so pre-pregnancy, if they want to do some shodhana or purification of the body, or they have certain conditions that the motility of the shukra is, or the sperm is less, the sperm count is less, previous history of some abortion is there, or they had to do abortion, or it happened. So in those cases, whatever you say or tell the patients about their condition has a very big role or a big impact on their mind. If they are aware of their conditions, they will come with that disturbed mindset itself. Reproductive system, so things related to, one is the sexual activity, and second is the reproduction. Both these are very sensitive topics in the society. Hence, they have a very big and large impact on the mind of the person. So, whenever you are dealing with patients related to such conditions, working on their Shukra and Artava Srotas is important, no doubt, but equally important is working on their mind. So, uh, giving medicines which will help in giving strength to their mind also will help. Okay. Mutra Srotas, it is used in Mutra Krucha. We know difficulty in passing urine is Mutra Krucha. And Puyameha. Okay, Puyameha is again one type of Prameha mentioned in the classical textbooks, which can be correlated to UTI, which is urinary tract infection. Because this is Shankapushpi has Mutra Virechana action, hence it will be very useful in Mutra Krucha and in Puyameha. Rasayana, it has a Rasayana action and Balya action as it pacifies Tamaguna, Rajaguna. Okay, what is Rajatama? You are aware. So it pacifies Raja and Tamaguna and nourishes Dhatus and excretes Malas. Hence, it has good uh, Rasayana action on the body. Okay, dose Kalka is 10 to 20 grams. Kalka, okay, Kalka is the paste, and when you use it in powder form, then it would be 1 to 3 grams usually in dose. Kalpas Shankapushpi Panaka. So Panaka is the water Shankapushpi Panak. Medhya Kashaya. So a ready preparation Medhya Kashaya will be Kashaya in this context is Kwath. Okay, so decoction, ready fermented decoction, which is Medhya Kashaya. And Saraswata Churna. Now this is a combination of herbs. Churna is it's a powdered yog. Now this you can call it as yog. Saraswata Churna is a combination which has Shankapushpi in as one of the ingredients. In Amayika Prayogas, its juice is mixed, fresh juice, Swarasa, is mixed with Kushtha and honey and is useful in Unmada and Apasmara, psychological disorders. So Swarasa with Kushtha. Now Kushtha here is Kushtha herb, which we have studied. Okay, Kushtha herb. Shankapushpi, Jatamansi, and Brahmi. All these three are herbs. Powdered together is given in Apasmara. So, as I was mentioning about Medhya action, Raktastambhana action, or whatever action. So, similar action herbs are put together as combination. So, you will find similar ones in Shonita Sthapana Gana, Vedana Sthapana Gana, or Vargas, or different combinations. So, this is one combination, Shankapushpi, Jatavansi, and Brahmi. They can be, their powders can be mixed together and can be given in apasmara condition. Saraswata Churna containing Shankapushpi is medhya and nutritious. So, it nourishes the Majja Dhatu, okay, medhya, and is licked with honey and be followed by milk. So when Saraswata Churna is given, you ask the patient to take a certain uh, quantity based on your diagnosis and Dusham, Desham, Balam, Kalam. That quantity, take equal amounts of honey, mix it, lick the paste, and after that, milk can be given as anupana or uh, as a good quantity, like a half a cup or a cup of it, based on what nourishment or what extent of nourishment is required for the patient. So the quantity of milk you can decide based on the age and strength of the patient. Okay, so nourishment of the dhatus basically is what is the intention of giving milk along with the medicine. Chemical composition wise, its Panchanga contains two types of crystalline principles and Shankha Pushpin as alkaloid. I had mentioned about the actives. So actives are get named by either their name or Latin name or their action, etc. So Shankha Pushpin is the alkaloid or active which is present in Shankha Pushpin. In modern research, it produces symptomatic relief and quantitative reduction in anxiety level and neuroticism in anxiety neurosis. It also produces reduction in level of plasma cortisol and catecholamine. In experimental studies, slight sedation, but no analgesic or anticonvulsant effect seen. So, sedation, nidra janana, anxiety level reduces anxiety, and so basically works very well on the mind. The psychology is what is a modern study. So, what validation? I mean, does not really need validation. However, whatever the modern studies have happened in that, the clinical trials showed that it has good effect on the sedation as well as the anxiety levels reduce. Hence, automatically the excitement, the blood pressure also helps. It reduces in the patient. So Shankapushpi is a very good herb uh, for overall the Manovaha and Majjavaha Srotas. Okay, fair. So I think with this we cover Shankapushpi, and let us take a quick break of say 15 minutes and come back to learn the next herbs. in the pipeline. Okay. So let us take a quick break, Hillary.